that they want to do physical activity, you know. So next time, I suggest that you also add some, you know, sitting down.
In your case, they made an exception. They were giving you a standing ovation.
Thank you, Labros, one more time for your amazing lecture, very inspiring one. Before we all start picturing ourselves in this beautiful Mediterranean islands, I think it's time to introduce our next speaker, next lecturer, Professor Joyce Cankry from the University of South Wales, but she's today representing also EUREPA, which stands for European Rural and Isolated Practitioners Associations. And she will be speaking about social prescribing. So we can easily connect this subject also to what Labros was speaking. Please welcome Professor Joyce Cankry.
Good morning. I'll try and catch up, but how do you follow that? So it's really talking about issues around social prescribing and what we've been doing in Europe, okay? So just to clarify, social prescribing involves helping people with their social, emotional and practical needs through non-clinical community support to improve their mental health, physical well-being by giving them time, focus on what matters to them and help them take greater control of their own health and well-being. And it's also social prescribing offers a non-medical intervention to provide early intervention and prevention of disease for patients at risk. So EUREPA is European Rural Isolated Practitioners Association. And in EUREPA, we've been trying to discuss and think about ways forward, and we've been running workshops across Europe on social prescribing and the issues that have been arising. So we've been talking in Poland, in France, in Ireland, in London, but also we've had delegates from across Europe, and also one of them was a world meeting, and so we've had perspectives from other people as well. A lot of the people that participated felt, in actual fact, in a lot of their communities, they've always been actually referring to their local groups, but it's not been known as social prescribing. And in actual fact, in Catalonia, Spain, this has been specifically happening since 2012. They felt social prescribing would assist the GPs in the health of their patients. And in actual fact, they have, in Catalonia, 433 health centres involved, 852 libraries, and 176 councils. So they are really thinking how we can actually get to the community and work with the community and what we can do to look at it, doing it different ways. So social prescribing also fits in with addressing the management of long-term conditions, improving the health and well-being of people in Europe. And, but also, one of the issues is it's been found that those who have been helped by working with groups and receiving care actually go on to volunteer and then often into employment themselves. So instead of being at home and not being able to afford to do things, but also in being able to enjoy life, it's important to think about how it will make a difference to their lives, of them and their families. So this is just about the European perspective, and really thinking about, it doesn't work. Okay, is there a problem? In some of our countries, such as Germany, there's no link between health and social care. Many of the healthcare professionals have no idea of what happens in their communities. People are concerned about the non-response and concerned about a person, such as actually what happens within communities that used to happen. And the issue is, where is the priest, the vicar, the postie, the parish council that used to actually pop round and see people but don't anymore? It is seen as a symptom of a failed society. So, and especially since the people don't seem to communicate as much, you know, especially in the advent of mobile phones. So it's seen as a need to, in actual fact, re-establish communities. So it's a means of doing this. And it's especially an issue due to transport. And also reluctance for many people to change. Our previous speaker was saying, you know, actually, you need to change. You need to think about how to change your life to make it better. In Slovenia last week, one GP saw 95 patients in one day electronically. So it's an issue. They also feel there's a lack of control. It is a worry that if you're engaging significantly in such a workload, actually, are you missing anything? It's a worry and anxiety to people. And it's thinking about, is it safe if I refer somebody to a social environment? What is the quality? However, there's a need sometimes to have an honest conversation with people. You see them coming back week in, week out. Actually, are you solving their problem? Do you need to speak to them and actually find out what the issues is so that you can actually address it? There's also been an increase recently of burnout amongst GPs, but also it's been affected by fatalities due to COVID of not only GPs but the healthcare workers. And it is important within communities to think about who could lead this. It doesn't need to be a GP, and in actual fact, a lot of GPs feel it's not their role. So it's thinking about leadership. And it's also about time. And it's also thinking about time not only to find out what is in the community, because a lot of people don't know, because they have no idea. So it's also about time to talk about social prescribing to the patient and saying, well, actually, some of these community groups that are around might be good for you. But also, it's thinking about, if you've only got a slot of 6 minutes, where's that time coming from? And it's thinking, really, we need to think about the time slots, what time's needed, but actually, will it save time? And also, in a lot of European countries, there's no resources. The GP is alone, and then they're working alone. They have nowhere to refer to. Sometimes they can refer to secondary care, but often not. And there's a heavy workload, not only to the patients, but in documentation and in authorities. And it's thinking about time to communicate to other professionals within the community, but also community groups. How do you set up that relationship? Previous speakers said, you know, actually, we need to enjoy life and think about it, but also there's ways of doing that. But also, you know, money does have a problem. And it's a problem because people are moving out of communities. They are working, they don't have employment there, they have no money, and so they're moving out of their communities and then leaving behind the old and infirm. There's huge amounts of migrations at the moment going across Europe due to conflicts and also disasters. So it's thinking about how are the GPs in the wider communities going to cope with the huge increase in some communities of different populations that don't speak the language, that don't know where to live, and have families that they've got to care for. And it's the lack of awareness of what social facilities are, but also GPs in many countries do not want to change. This is what I've done. And I can tell you from doing research after many years, going through GPs' notes, sometimes you can tell when they trained because of the medication they prescribe. And sometimes, this is what I learned in medical school, and I'm not going to change. So it's thinking about who's going to cover the costs that's involved in running community groups. Because it's not cheap, because you've got to sometimes have a venue, you've got to have a facilitator, and you may want to have food, you might want to think about what activities you're going to do. And it's one of the things that they said, that there needs to be politicians involved, or somebody who holds the purse. What's come across from all of the working groups that we've been working with is the need for education. And it's not only need for education in medical students, but it's also the need for GP training and other healthcare professionals. And it's also, you know, how do you arrange within the curriculum to visit community groups and see what's actually happening and what impact that's having on people's lives. And it's thinking about, within the curriculum, about what are the non-medical interventions that could be provided, and they can have fun, they can meet people, create new friends. And so it's thinking about looking at things differently. And it's sometimes saying to some of the medical students, what about volunteering? But in actual fact, some medical students have been volunteers before they've gone into becoming a student. But it's important of informing them about, you know, different ways of addressing the situation of people's health and well-being. Okay? One of the arguments a lot of the time is the lack of evidence. But that's the lack of evidence sometimes about talking about social prescribing, because social prescribing is a new catchphrase. But in actual fact, there's lots of, there was a recent literature review saying there were small studies, the confounding factors, there's withdrawals and there's dropouts. However, if you look at the literature, not looking at social prescribing, there's lots of studies that show that in actual fact the whole idea of social prescribing works. So Hope Start UK actually was founded in 1973. It has over 300 branches across the UK. It runs them on a weekly basis. Volunteers go in, and they help with different aspects of people's lives, what's important to them. And they go in to male parents and female parents, because in actual fact, nowadays, there's a lot of men that look after the family. And so it actually has demonstrated, if you look at the data, the analysis was done on 34,000 families, on 76,000 children. What difference has it made? So going in, helping them to go to mother and toddler groups, going to the doctors, going to the dentist, going to have an appointment for their mental health, it actually made a positive impact on the parents' parenting skills, the parenting's well-being, the parents' well-being, the child's well-being, but also on family management, how to budget within the household, how to manage conflict within the family. All different aspects. But also what happened was, if you look at the data, that a lot of these people that were helped actually go on to help other people. And they actually go on to various employment. Also, there was another family orientated in Wales called Our Place. And it actually came out of actually young teenage mothers helping with another huge Department of Health study. And they helped with the leaflets, the documentation, everything. And they were absolutely brilliant. But I didn't realise what value that made to them. And so actually, at the end, instead of going on to benefits, they went on to higher education and employment, which was absolutely amazing, really. But also, it actually highlighted the need for a place for young mothers to go and and especially those that have been in care, to learn about how to do budget cooking, how to budget for the family, how to negotiate skills, stress management, and also, you know, the dental health of them and their child. And this picture of this young mum, so she'd been to various events, but she was volunteered to do a session on going and buying the food, making the menu, and did a demonstration on how to cook from scratch and how to make a good meal on a budget. And in actual fact, obviously she didn't know it, but she got paid for doing that session as anybody else would. But she actually went on to a hotel management as a role. But talking to the parents, what difference did this group make to you? And they came back and said, we talk all the time. We dance, we sing, we make more time for bedtime stories. We cook together, we clean up the toys. We explain things in the supermarket when we go on the bus, out for a walk, and in the bath. So they actually, although this is what was taught, because the activities not only covered, you know, life skills, but also it taught them about activities to have fun. So it's looking at it, thinking what benefits there are, but it's also thinking about who and what can be involved, and it's also thinking about the whole range of thinking about, one, the third sector and charities. They try and get money to take things forward. County councils, also public health, you know, social and welfare, housing, but also, you know, one of the people that are in the group for Eureka has a social farm. So people can go to the farm and enjoy being on the farm and actually helping out on the farm. So it's really trying to think about social, physical well-being, volunteering, and also thinking about other people. So it's thinking about what they thought were solutions. And it's really came across from everybody, is thinking that actually it's multidisciplinary. It's a whole range of people working together to make activities happen. But also it's about starting small. You don't want to take the world over. It's thinking about, you know, what can we do first of all to make this happen? In Spain, to start what they did in Catalonia, they actually mapped out across the region what was happening, what community groups were happening, and put it on a website. So actually, they could, from their GP referral, actually go into the record, find some community group, and actually advise them. But also, what they did with their libraries, some of them, is help people to learn to read and write. And also, not only the Spanish people, but also migrants within the community. So it's about how can you involve the migrant community that are moving across Europe to actually help them make a difference. And it's about the signposting, but also it's thinking about working with social workers as well. And I remember going to do something about heart failure, and we were going to have this conversation. Health came in one side, social care came in the other side, and never the twain to speak. But hopefully it's improved. So it's thinking about having a positive return for the patients. And it's thinking about, you know, as we've done with our place, it's developing and creating new initiatives sometimes, but also working with people that are already there. And it's thinking about working with the various faith-based, organisations and making resources available. But it's also coordinating care. It's thinking that actually sometimes you need to say, okay, go and see them, but make sure you come and see me later and check out. But also it's thinking about how you can engage politicians in various ways. In one of my roles in Welsh Government, it was important to think about how, and one of the benefits of being working in Welsh Government, as you'll learn, is you write the minister's speeches. So you know what they're going to say because you've written it, and you're making sure that what you want is in the speech. So it's thinking about, being aware of, thinking about it's not only medication that makes a difference to people's lives. So it's really thinking about impact. It's improving health and well-being, reducing inequalities in health, increasing skills and activities, and having fun, behaviours, having fun as well. It's building new relationships. One of the issues with the one in the community was they actually did cake bakes, they did charity runs, they did other activities to help people. But not only that, they invited the Lord Mayor along as well. So it's thinking about how you can engage people to participate, but also how you can actually engage politicians to raise their profile, but also to your benefit. So it's, and it's also effective in reducing polypharmacy. So it's really, in conclusion, it's thinking about rethinking and improving well-being in communities and focus on harnessing the strength and power of the communities rather than viewing them as bundles of needs. And it's about social relationships have a value. Everybody has a value. Social connectedness has a profound influence on well-being, issues on long-term illness, employment, and also for the patients and the community. And the good news is, we actually, from Eureka, put a bid into the World Organization for Colleges and Academies and associations in general practice in Europe to become a special interest group. And it was social prescribing and community orientation, and we were successful. So we are going to have a new initiative going across Europe, looking at social prescribing and thinking about how it can benefit family doctors, patients, communities as a whole.
Thank you so much, Professor Kenkry, for this drafting of a